Welcome to the last video finally of this unit, and it's the chapter 13. So we're gonna be reading the same as the past video. So I'm gonna be reading the theory in English, then translating into Spanish, and the exercises used in English. So let's start. Chapter 13. The overseas doctor. A. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council (JMC). There are several types of registration. We got the professional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area members states. Two is the full registration is for doctors who have completed year clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year clinical training in the UK. And the last one is a specialist registration. It's for doctors who have completed specialist medical training and have a certificate of completion of training (CCT). The GP register is a register of all those eligible to work in general practice in the NHS. B. PLAB or PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skill, and attitudes. Part 2 is an objective structured clinical examination (OSCE). It consists of 5 minutes clinical scenarios, known as stations to assess professional skills. C. Blood stations and advice. Clinical examination. Your ability to carry out a physical examination of a similar patient and after training to play this role will be assessed. Comfortable or intimate examination will be carried out using a mannequin and anatomical model. 2. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. 3. Communication skills. Your ability to interact with a simulated patient, or in some cases, the examiner will be assessed. Skill tests may include breaking bad news and giving advice on lifestyles. And the last is story taking. Your ability to take an accurate history and make a recent diagnosis will be assessed. Advice on the stations from a successful candidate. Read the instruction outside each station carefully. You have one minute for this. 2. Keep in mind safety precautions like throwing out the sharps in the sharp bin. 3. Don't forget the ABC. Airways, breathing, and circulation protocol in every emergency station. And the last is should the patient understand what is happening, then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. Note, charts are needles and blades which must be disposed of safely in a special container called as a sharp pins. Okay, so the next step is just translate. So we're gonna start. El médico extranjero. Tipos de registro. Para atender y tratar a pacientes en el Reino Unido, todos los médicos deben registrarse en el Consejo Médico General. Hay varios tipos de registro. Está el registro provisional, que esto es para médicos que acaban de graduarse de la Facultad de Medicina en el Reino Unido o de ciertos estados miembros del espacio económico europeo. El segundo es el registro completo, que es para médicos que han completado su año de formación clínica El tercero es el registro limitado, es para graduados médicos internacionales que no han completado el equivalente a un año de formación clínica en el Reino Unido. Y en el último lugar tenemos el registro de especialistas, que es para médicos que han completado la formación médica especializada y tienen un certificado de finalización de la formación o CCT o CCT. El registro de médico de cabeceras es un registro de todas las personas elegibles para trabajar en medicina general en el NHS. Ok, B, el PLAB. El PLAB. Antes de que puedan obtener el registro completo, algunas categorías de médicos extranjeros deben realizar el examen de la Junta de Evaluación Profesional y Lingüística. El PLAB está diseñado para garantizar que quienes lo aprueben puedan ejercer de forma segura al nivel de un SHO en una primera cita en un hospital del Reino Unido. La parte 1 consiste en una prueba escrita de conocimientos, habilidades y actitudes. La parte 2 es un examen clínico objetivo estructurado o el ECO. Consta de 16 escenarios clínicos de 5 minutos conocidos como estaciones para evaluar las habilidades profesionales. Ok, ¿dónde me quedé? Ok. El C, estaciones y consejos del plan. El primero es un examen clínico que se evaluará su capacidad para realizar un examen físico de un paciente simulado, un actor entrenado para desempeñar este papel. Los exámenes incómodos o íntimos se realizarán utilizando un maniquí en un modelo anatómico. El 2. Habilidades prácticas. Se evaluarán habilidades prácticas como suturar y administrar inyecciones intravenosas. El tercero es las habilidades de comunicación. Se evaluará su capacidad para interactuar con un paciente simulado o en algunos casos con el examinador. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre el estilo de vida. Y por último, toma de la historia clínica. Se evaluará su capacidad para tomar una historia clínica precisa y hacer un diagnóstico razonable. Ahora, por último, estos son algunos consejos sobre las estaciones para un candidato exitoso. Okay. Lea atentamente las instrucciones fuera de cada estación. Tiene 1 minuto para esto. 2. Tenga en cuenta las precauciones de seguridad como tirar los objetos punzantes o el contenedor para objetos punzantes. 3. No olvide el protocolo ABC, vías respiratorias, respiración y circulación en cada emergencia. Y por último, compruebe que el paciente entienda lo que está sucediendo y luego pregúntale sobre cualquier inquietud que pueda tener. No se limite a dar un sermón, escucha atentamente lo que dice el actor. And now I'm gonna be reading the parts, the exercises, but just in English. Okay, we first got the 13.1. What kind of registration might these doctors obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor is going to be a provisional registration. 2. A newly qualified Nigerian doctor, limited registration. 3. A doctor who has successfully completed the first foundation year, full registration. 4. An SHO who has successfully completed the foundation program and gained a certificate or completion of training after several specialist registered posts. Specialist registration. Okay. 13.2. This one. Write the abbreviation in words. Look at A, B, and C opposite to help you. 1. Any doctor who wants to work in the UK must register with the JMC, General Medical Council. 2. Some overseas doctors must pass the PLAB just before they can register professional and linguistic assessment board. 3. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. 4. In any emergency, remember the ABC protocol is airways, breathing, and circulation. 5. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. And the last exercises is 13.3. Complete the test. Look at A, B, and C opposite to help you. My name is Mosa, and I come from Yemen. I came to the UK about 2 years ago after graduating, because Yemen is outside of the EEA. I call it them limited registration with a GMC. At first, it was very difficult for me to obtain a place on a foundation program. Otherwise, with good English, I have to take the PLAB. This to show that I could work safely in the UK. If I had give some advice to other candidates, it will be that counseling station. You should simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the information right, the intonation right. Okay, let's continue. After completing my year clinical training, I was able to attend full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics. As hospitals now have to demonstrate the range suitable candidate for the EEA. Once I complete my second foundation year, I shall obtain a CCT, which will allow me to proceed to a specialist registration with the GMC, an important step on the road to becoming a pediatric consultant. So that was all. Thank you for hearing me and for taking your time. So see you the next unit. Bye.